My name is Lydia Kabuge. I am a reproductive health clinician. So I basically I've specialized in reproductive health and majorly dealing with women and their issues. And that means both gynecological and obstetric issues. But I'm majorly dealing with women seeking gynecological treatments. So abortions and post-abortion care is part of what we do as part of gynecological treatment. From my growing up, I think yes, I would say yes, I heard about abortion, but though it was discussed silently, and I think if I could give an instance, I think there's this girl when we were in primary school. Of course, then those girls who were in class 8 were big girls, unlike now you have very small girls in school, but then we had very big tall big girls in class 8. And I remember there's this girl we had that she got sick, and then I don't know what happened, she got admitted to a hospital, and the other thing we had is that Jane is no more. And I remember now when she died, the issues in the stories in the village, you know, we could see women discussing in very low tones. But I remember one of my eldest sister told us that actually Jane died because of abortion. And I think that is the first time I heard about abortion, and I actually feared everything to do with abortion. So we were told she committed abortion, and that is why she died. And I think the first and the very important message that was put in our minds is that anytime you do abortion, you die. So yes, I heard about abortion, and I grew up knowing this is a bad thing. I remember this one night that a lady came bleeding profusely, and you know, she had so many clots and almost going into shock. And then from where I was working in Murang'a, we never used to give the post-abortion care services. We used to refer them to admit the patients, and that was being done by the medical officers. So I never got a chance to do an evacuation, you know, just to save this life. So when this girl came, I was so worried, I didn't know what to do. And I think the nurse, thanks to him, who was in maternity then, somehow detected that I'm not able to help this girl. And so he did put on his gyne gloves, and I saw him get into the woman's, you know, vagina and tried to expel all those clots. And then he told me, Lydia, we need to evacuate this mother. She's going to die. And so we evacuated this mother. Then I felt so ashamed because I couldn't help this woman, yet I was the clinician on duty. So I booked an appointment with this nurse, and I told him, I think I want to be reminded how to do a manual vacuum aspiration, because I wouldn't help this woman were it not for you. Abortion has really contributed a lot in maternal mortality, and we're getting so many cases, so many complications. Many are coming from infections, so that you find girls have gone to seek for abortion services, and they get this, they land on these unsafe hands, and so they get unsafe abortion, and they get complications from that. And most of them are coming with sepsis. In where I'm working in Kiambu, level 5, we get a lot of patients coming in with infections, you know, sepsis. Yeah, and most of them end up even losing their uteruses. And of course, you know, they're young girls. So basically, if they don't even lose their uteruses, you will find the sepsis has actually, you know, destroyed their fallopian tubes, and therefore, basically, that woman is not able to conceive ever. think for us as providers is not to judge these women, is to listen to them, get into their shoes and try to support them. Because when these women come to us with this decision, they have, believe you me, they have thought of it, they have sought for information elsewhere, and they are coming to you now with a decision. I think the best we need to do is to listen to them and help them. And thereafter, we need also to take care of the future, so that we do not want to get this woman coming back again, seeking the same services. And that's where the issue of contraception comes in also. So that as a community, again, we need to embrace the contraception. So we are getting so many teenagers coming to us, and you find there is a lot of debate on, are we supposed to give a contraception or not? This girl comes to us 3 times, 4 times. She's 20 or she's 19. She's sexually active. So the minute she walks out of that door, she will basically go back to what they were doing, and they will come back. So I think I would encourage that we teach and we encourage contraception use. And again, when these women come to us seeking abortion care services, let's support them, let's listen to them. They are undergoing emotional, physical, some of them, they've been, violated. Let's listen to them and support them in all ways, holistically. That means physically, emotionally, talk to them and listen to them. If it calls for spiritually, you need to get to that, let's do that, just to make sure that we help our women and girls.